Hi, I'm Dr. Maria Westerfield. I specialize in primary care, sports medicine, and family medicine. I'm currently working at Rockmart Primary Care with Atrium Floyd. So I grew up in a really small town in Pike County, Georgia, and then after high school, I went off to University of North Georgia in Dahlonega for undergrad. Following that, I went to Mercer Medicine in Macon for my medical school, and then I decided to leave the state for just a little bit. I went to Greenwood, South Carolina. I did my family medicine residency at Self Regional Healthcare and did a sports medicine fellowship there as well, and then decided it was time to come back to my Georgia roots, and so that's how I ended up here in Rockmart. I've always enjoyed being in roles that involve leadership, advocacy, building relationships with people, and so decided that being a physician is the best way to do that, especially coming from a very close-knit community, small town. I grew up in a very rural area where we had limited resources, limited access to healthcare. And so that was my big thing, was I wanted to go back to that community that shaped me so much and be able to offer something back to them. And I think that's the beauty of primary care and sports medicine, is you're able to provide this special service to a population that normally doesn't have access to that. Practicing good medicine is more than just understanding the symptoms. It's actually more about understanding the patient. Patients want to be heard, so I really try to focus on actually taking the time, listening to them, making sure that I explain things in plain terms so that they understand what the differential is, the diagnosis, what their treatment options are. If you ask any of my primary care colleagues, say over half the patients come in with some sort of musculoskeletal complaint. And so sports medicine really allows me to be able to provide the special skill set to a community that normally wouldn't have access to a lot of that care and treatment. So I love being involved in the community. So outside of practicing medicine, like I've been on several international medical mission trips, I like to volunteer in free clinics, just be involved in the community. I think that's kind of a big role within medicine, is not just practicing at the clinic itself, but being an advocate and being involved in the community. Very excited to be here, excited to grow and get to know everyone in the community, and I'm really excited to meet everyone.